Hi, my name is Dr. Rebecca Stevens. I'm an acupuncturist and doctor of Chinese medicine.
And I'm Dr. Evangelina Stevens, naturopathic physician.
In this video, we're going to show you 5 easy pressure points that are really useful in helping to coax along a ready delivery, as well as providing some pain relief during labor. At the end of the video, we're also going to show you a quick and easy massage technique for the delivery room.
It's important to always talk to your healthcare provider before using these points, as well as it's usually considered very safe after 37 weeks. There may be reason for you not to stimulate these points.
We're going to break these 5 points into 2 categories for you. The first 3 points are going to be helpful points to stimulate contractions, and the second 2 points are going to be the pain relief points. The first stimulate contraction point is called spleen 6. You will find this point about 4 finger breadths above the inner ankle bone. So, find the inner ankle bone, and about 4 finger breadths up, you will find a tender spot right behind the lower leg bone. A very useful characteristic of these stimulate contraction points is that they should feel noticeably tender, helping you determine when you are on them. The second stimulate contraction point is large intestine 4, which is located on the back of the hand. Find the metacarpal bones, or long hand bones, of the thumb and index finger. You will find a noticeably tender point between them. You may find that the point on you is slightly closer to the index finger side. The third and last stimulate contraction point is called gallbladder 21, and this is a tender point located on the top of the shoulder. The best way to find this point is to find the spine and tip of the shoulder. Draw a line between these 2 markers. Gallbladder 21 is located at about the midpoint. Press in this area until you find a noticeably tender depression. Our second category is points that provide labor pain relief. Both of these point pairs are located on the lower back. These points can be really useful leading up to and in the delivery room. Our first pain relief point is urinary bladder 26. On the lower back, just above where the lumbar spine meets the sacrum, are 2 soft spots on either side of the spine. You will usually know when you are on these points, as they can provide instant pain relief. It can be a little easier to locate the sacrum by first finding the tops of the hip bones. Trace this line level inwards to the spine and press downwards on either side of the spine until you find the solid bone. These 2 points are located just above this bone. Our second pain relief point is urinary bladder 32, and you will find this point about an inch or so directly below our first point. It is actually located in the second sacral foramen, which is a hole in the sacral bone. Find this point by pressing around this area directly below our first point on the hard sacral bone until you find a soft depression. This point is doubly useful as it can both assist contractions as well as provide pain relief. It is most ideal if you have someone help you with these points, so you can just relax and focus on your breathing. These points are best pressed with the breath, applying pressure with the exhale, and releasing with the inhale. Remember that these points are all going to be quite tender spots on the body, so take care not to overpress them and cause bruising or discomfort. We recommend pressing these points 5 to 10 times each for about 3 to 5 times per day.
Next is a simple massage technique used for the delivery room to be performed by whoever will be accompanying you at this stage. This is used to help take pressure off the back during contractions, especially if you're experiencing back labor. The first technique is to press inwards on the hip joints themselves with equal pressure, and it may be easiest to use your fists as you can probably push a bit harder, and just squeeze. This really helps to open up the hips so the baby can descend down into the pelvis. The second technique is a massage on the sacrum. So find the sacrum, being that solid bone at the end of the spine. And either while someone else is squeezing on the hips, or by using one hand to stabilize on one hip, apply moderate pressure, as much as a pregnant woman can take, in a circular motion during a contraction to help relieve that discomfort.